good morning. I'm going to introduce myself. My name is Linnea Hjalmarsson, and I am a psychiatrist who specializes in children's and teenagers' psychiatry. So it was very difficult for me to give a name to this conference. I started off talking about pain, but then decided I would start talking about giftedness and stress. But it's a very global topic, and it's actually because it's very difficult to define what difficulties gifted teenagers or children can be faced with. I'm also going to talk about how sometimes giftedness can worsen some conditions if a child, teenager, has already an underlying condition or is likely to develop a condition. So giftedness is not a disease, it's not a condition, a medical condition, but gifted children can be faced with some unbalances, can be faced with some difficulties. There's often a lot of stress for these children, and I'm talking from the point of view, my point of view as a psychiatrist and psychologist, but I'm also a doctor, and I'd like to talk about how the stress gifted children undergo actually can lead to some physical conditions. Children don't start complaining about their giftedness until about 5 or 6, but before then there are some physical manifestations of their ill-being. They'll complain because they have tummy aches, or they'll have some skin conditions, eczema, for example, or they'll have asthma. So there's an area of study which is the link between the psychical, the immune system, and the endocrinological system as well. Studies have been carried out on how stress, anxiety, and living difficulties can worsen or lead to the appearance of a condition, a medical condition. Recently, I was actually quite surprised to get some children at my cabinet, children who'd been sent to see me by dermatologists because they'd lost their hair. Now, some children can be faced with a real problem, a problem that cannot be solved because they can't verbalize, they can't put what they're going through into words. So, these children can have psychiatric disorders. They can be quite ordinary disorders, but they can just be fears that resemble other children's fears. But these fears will arise earlier and will be more intense than for other children. And sometimes parents just don't know how to cope because these children's fears are more intense than other children's. Take the fear of death, for example. It's expressed with a child's words, but it's actually more serious. They take it more seriously than a normal child. They're more worried than a child of their age is normally. And parents find it difficult to answer to the child in a calm and objective manner. It's something that starts from a very simple thing, but it can lead to anxiety, it can lead to psychological troubles and even phobias. And anxiety can be linked to interaction with other people and social phobias. I remember some young children suffer from social phobias and can't really relate with their peers, so they'll turn to adults with whom they'll have an easier interaction. They'll find it easier to get on with. Some children suffer from tics, obsessive movements, which are due to stress, which can actually lead to CODs. I can remember a 4-year-old child who had CODs and had to prepare his clothes on the evening before going to school. And he prepared his clothes. He always prepared 2 sets of clothes to make sure that he had the right, appropriate clothing for his outing the following day. In more serious cases, it can lead to the child or teenagers depression. They can be depressed. And giftedness and stress can explain and also favor stress, as well as the existence of psychological and psychiatric conditions. But what happens is that there are other conditions that can take into account giftedness, but don't explain everything. Take psychiatric evaluations take into account the temperament of every child, and in some cases the child can be introverted and insecure, and this means that their interactions with their family is very difficult. The parents are actually afraid of what's going on with their child, and the interaction can be very difficult. There can be, for example, difficulty in a parent's couples, or other difficulties linked to a child's death in a family, cot death. Take a small child who's in his family there's been a cot death. The younger sibling has died at a very early age. Now, the child will be at an age when they're afraid of death, and also they'll be jealous of the younger sibling. The death of this child or be perceived by a gifted child as being their fault, their responsibility. They think that what they thought was magical, that they have magic powers. And social problems of interaction can arise from kindergarten on. Some children's difficulties to interact with others will arise from kindergarten on because they can't integrate into the group, because they're too different from the group. And this problem actually worsens with age. Because a gifted child's peers won't understand the gifted child. They'll think they're strange, an extraterrestrial, an alien, or insane. They'll be teased mercilessly, and or become, in some cases, the scapegoat of the class. I remember one case of a little girl who just started primary school. She was ostracized from the group. No one would speak to her, only the teacher, who quite liked her and tried to help her. But this child didn't interact. These children are perceived as speaking. The children of the class didn't like her because they thought her way of speaking and her way of interacting with others was not adapted, so they made her suffer. Thank you.
La spécificité, la précocité donc, entraîne elle-même, génère elle-même ce stress. Le stress donc, de l'enfant qui a une haute conscience de lui sur des domaines différents. C'est pour ça que j'ai commencé la conférence avec cette image de ce film qui est Le Petit Garçon, qui est un film qui parle d'un enfant surdoué et d'un enfant qui doit avoir à peu près 8 ans.
I think you all know that giftedness can lead to stress. Children are very aware of many things, very aware of themselves, are aware of other things. Now, at the start of the conference, I talked about gifted children, and gifted children can be very aware and more stressed. Take the case, no, at the start of the conference, I showed you the picture of a film, a movie, which is about a gifted child, and this gifted child is a child who's just 8, who has a stomach ulcer, and it's believed that this child has a stomach ulcer because he asks too many questions on war and too many questions on life and death. So precocity can lead to stress because they're aware of being different, and very often relationships with their parents can be difficult because a gifted child is often a child that speaks well very early, and they speak so well that parents are actually tricked by their child, and it's very difficult for the children. So many of the children I've seen have problems at school, but there is also an educational problem because the parents don't know how to manage their child, and many gifted children have had very difficult teens and have gone into drugs, for example. They smoke cannabis, for example. So the parents don't know how to manage this gifted child. They've never been able to say no to their child. The child doesn't know what being denied their desires mean, this frustration. That means that these children or teens are sometimes totally at loss. They have no bearings. And in those cases, I have to ask for a separation from the family in order for them to be able to rebuild their relationships. But that is really a last resort. We really try and work with the family, and family therapy plays an important part. Often, gifted children have other difficulties because a gifted child isn't brilliant in all areas. It's not totally balanced. So they can have problems with dyslexia or problems with motor functions or problems with spelling. The role of a psychiatrist is to do a full assessment of the child's competence, to make a mind map. It doesn't just stop at the IQ test. There's other areas we have to look at. Very often, gifted children are hyperactive, and hyperactivity has been seen as a symptom of precocity, of giftedness, but I do not agree. A child is gifted, and on top, he or she is hyperactive. Hyperactivity is not linked to giftedness as such. It's a neurological disorder, and it's linked to impulsivity and other things. It's sort of like hi-fi. You can choose what you are. When you listen to the radio, you can choose the level you're at and the levels of sound. So, for example, you have a child who's very active physically, but finds it very difficult to concentrate, or a child that's a dreamer who finds it difficult to concentrate as well. So they're impulsive, and they also have a lot of problems with behavior. Gifted children and teenagers tend to be aggressive towards others sometimes, and aggressive towards themselves, so they can cut themselves or mutilate themselves. One teenage girl I met had many issues like this, and if I'd only taken into account the psychological aspect, we wouldn't have gone far, because I had to take into account other underlying issues. Take, for example, her hyperactivity, her depression, and then her giftedness.
C'est comme une chaîne IFI, une ancienne chaîne IFI, il y a 3 curseurs, et un enfant peut être très moteur et peu perturbé sur le plan de la concentration, alors qu'un autre enfant sera plutôt extrêmement rêveur dans son coin, ne bougera pas mais aura un vrai trouble attentionnel. Et dans les deux cas, il y a très souvent de l'impulsivité plus ou moins évidente, une impulsivité qui va être cognitive ou comportementale. Et je reviens donc à ce type d'adolescents précoces et hyperactifs qui vont avoir plus de passages à l'acte, de menaces hétéro-agressives ou auto-agressives avec des automutilations. Et je me rappelle donc d'une fille de 15 ans qui est arrivée et elle venait pour automutilation dans un contexte familial très particulier. Et c'est vrai que si j'avais eu une dimension, une analyse uniquement psychothérapeutique, je n'aurais pas pris en compte aussi les problèmes sous-jacents qui étaient l'hyperactivité, la dépression et la précocité. Donc, pour aider l'enfant précoce, il faut donc reconnaître toutes les difficultés que je viens dont je viens de parler, et donc les troubles associés.
So, to help the gifted child, you need to know all the difficulties I've just talked about. So we need to see all the issues that are linked to this, and that's the role of what the psychiatrist has to do. That doesn't mean they have to go straight into medical help, but we need to assess the child fully. We need to see what their temperament is like. We need to see what their relations with their family is, what the relationship at school is. And we basically need to draw a full map of the child, both psychologically, physical motor issues, and also their relationship issues. It needs to be